Good morning. I am Sheila Polk. I'm the Yavapai County Attorney, and I'm also the co-chair of MATFORCE, which is the Yavapai County Substance Abuse Coalition, and the host of today's conference. On behalf of MATFORCE, I would like to welcome all of you for being here this morning, and thank you for attending the conference. MATFORCE, our Substance Abuse Coalition, focuses on all substances of abuse, including underage drinking. We have grown increasingly concerned about the drug marijuana. According to the 2014 Arizona Youth Survey, our kids' use of marijuana is second only to their use of alcohol. More of our high school seniors than ever before are using marijuana on a regular basis. More than 1 in 5 of Arizona's high school seniors are regular users of marijuana. The percentage of our students who are getting illegal or illicit pot from someone with a medical marijuana card has increased dramatically in the last few years. And more of Arizona's kids than ever before now believe that marijuana is harmless. In fact, 67% of Arizona's students think there is no harm in trying marijuana, and another 48% of Arizona's students think there is no harm in regular use of marijuana. Marijuana is not harmless. It is a mind-altering, addictive substance more potent today than ever before. It artificially stimulates the reward circuit of the brain, providing reward without effort. Marijuana impairs memory and learning skills and causes poor academic outcomes. It impairs judgment, and 1 in 6 of our kids who tries marijuana faces addiction. I hear frequently from parents of high school students and young adults who have begun using marijuana, and it breaks my heart every time. Kids who start down the path of using marijuana face significant obstacles ahead, both in terms of academic failure and addiction and lost potential. This conference today was put together as part of MATFORCE's Marijuana Harmless Think Again movement. The movement is a call to action to help raise awareness based on the science and the facts on the harmful effects of marijuana. We are excited today to bring you a distinguished panel of presenters who will shed light on how marijuana affects the brain, marijuana's link to decreased IQ and its link to psychosis, addiction to marijuana and effective treatment methods, and the impact of legalization trends on law enforcement in Arizona. The Rocky Mountain High-Intensity Drug Trafficking Area, or HIDTA, a federally funded agency, released just last week its 3rd report on the impact of commercial recreational marijuana in Colorado. HIDTA is the only organization that is collecting comprehensive data on the experiment in Colorado, and it is information Arizona must pay attention to as we consider the public health consequences of marijuana use. The 169-page report covers a litany of topics, and I want to highlight just a few of the key points from the report, because they show significant negative changes in Colorado since 2014, when retail marijuana businesses began operating there. In 2014, in just 1 year, there was a 32% increase in marijuana-related traffic deaths in Colorado. Colorado saw a 29% increase in the number of marijuana-related emergency room visits and a 38% increase in the number of marijuana-related hospitalizations. Calls to poison control in Colorado for marijuana-only related exposures increased 72% in that past year. And contrary to claims that legal marijuana would eliminate drug cartels, the yearly average seizures of illegal trafficking of marijuana in Colorado increased another 34%. Today, kids in Colorado ages 12 to 17 use marijuana at a rate that is 56% higher than the national average. Because our program is packed, I'm not going to take time to introduce each of our speakers before their presentations. Instead, please read their bios that are in your programs. And as you listen to these experts, I ask that you start thinking about what you can do with this information. What do you want the world to look like for our kids and our grandchildren, and not just our children, but everybody's children? I hope you will take the information you're about to learn and spread the word that marijuana creates yet one more obstacle to our kids' future and their success. Share with others the facts you are about to learn today. And last, don't forget to talk to the kids in your life, your own kids, your children's friends, your grandchildren, your nieces and nephews, about what you learned here today. As simple as it seems, talking to kids about the harms of drugs is a powerful antidote to drug use. Prevention works. Prevention means awareness and education. It also means implementing sound public policy designed to restrict access to harmful drugs. Prevention is creating communities where all children can thrive and succeed by removing the obstacles that drugs, including marijuana, pose to their success and their happiness. Now, just a few announcements before I introduce our first speakers. Everyone, take out your cell phones. Please make sure you have your cell phones on silence. I want to thank our wonderful sponsors and partners who have worked with us to make this conference possible today. Mercy Maricopa Integrated Care, Arizona HIDA, the High Intensity Drug Trafficking area for Arizona, the Arizona chapter of the American Academy of Pediatrics, Arizonans for Prevention, SAD, Students Against Destructive Decisions, Prevention Works Arizona, and SAM, Smart Approaches to Marijuana. Due to our full program today, I'm not going to introduce the number of dignitaries that are with us today, but we do want to thank them for caring about this issue. And certificates of attendance will be provided at the end of the day. Now to our program. A group of mothers who identify themselves as Mom Strong asked for an opportunity to tell you some true stories this morning. Sally Schindel lived and worked as an accountant and financial advisor here in Phoenix for about 30 years. Now retired and living in Prescott with her husband, Sally devotes her time working to reduce the incidence of youth substance use and abuse. You may already know of Sally's story and her son Andy's words of warning in his suicide note last year. Marijuana killed my soul and ruined my brain. Sally resolutely shares that story with teens and other groups to help Andy continue to help others, as he always loved to do. She has found friendship and support with this group of mothers we call Moms Strong. And I will ask Sally to introduce the others as they tell you their stories here this morning. Thank you.
Thank you so much, Sheila. Do I have the right height for my short body? I'm here today with my friend Lori Robinson from California. I'll introduce Lori more formally in a few minutes, and after Lori and I tell our son's true stories, we'll introduce you to Jody Belcher. She's the producer of the award-winning documentary Other Side of Cannabis, and she will share some of her true story with you. Anne and Brant Clark's story is on your tables. I hope you'll take that home and read that. It's one of the stories featured in Jody's film, Other Side of Cannabis. I just met Lori 6 months ago over the internet, along with our friend Anne Clark from Colorado, who we're sorry cannot be with us today. Prior to my joining Hearts and Minds with Lori and Anne, I felt lonely in a lonely club that I call the club no one wants to join. Our sons had all died by suicide, and it was highly related to marijuana use. There's a stigma on several fronts: suicide, drug use and abuse, mental illness. We've learned to forge through that stigma and stick our necks out to talk about what happened. Why? Because it helps us heal. It keeps our sons in our hearts and our minds every day, and we hope to educate enough people with our sons' stories that it will help save lives in the future. And we feel we have information and experience that is important not only to young people and to parents, but also to the medical and the treatment community. We are not here to ask that medicine be denied to patients with legitimate medical needs, only to ask that marijuana as medicine be developed safely and responsibly. And above all, we are telling our stories today in the hopes that others may be spared the anguish that we live with daily, because we firmly believe our sons' deaths were completely preventable. Ann Clark's son, Brant, was only 17 years old and died in Colorado, and his story on your tables is there for you to read later. And we're telling you only 2 other brief stories this morning, but we do know of many more. We know that you in our audience today know of many, many more stories of the harms from this drug. We know you're living in those stories today, I know, in some of your families and in your work. And we believe there are many more suicides related to marijuana use, and we know most people have a great deal of difficulty speaking out and sharing those stories because of the stigma I mentioned before, but also, and maybe more difficult, is the pushback we receive when we do speak out. We've experienced and we have seen the terrible comments that are made in social media. Maybe you have too. And newspapers, when our stories are told, we've been called liars. We've been called reefer madness prohibitionists and failed parents. We've been told we should be ashamed of our advocacy to educate about the risks and harms when so many want it legalized. We push forward through this because we feel it is important for all to know that there have not been 0 deaths from marijuana use, but we believe there have been many. Ann's son Brant is not a 0, and Lori's son Shane is not a 0, and my son Andy is not a 0, and we believe there are many more yet to come due to the ever-increasing potency of today's turbocharged pot. We have seen firsthand the incidence of psychosis induced by marijuana that science in this country is just now researching and starting to understand. We may be neophytes in the awareness of marijuana harms to the brain, though research studies are well documented globally. Our boys died before the science was well known or respected in America. And indeed, is it even yet well known and respected? We work to advance that knowledge and to take it to the public. Lori will tell you her story of her son Shane, who was only 25 years old when he died. And I've already told my son Andy's story many times in Arizona, and I'll continue to do that, and I'll give you a short review of that this morning after Lori speaks. And I know most of you here today are moms and your dads and your grandparents, and I'd ask you to please take off your professional glasses just for now and listen to what we moms are sharing from the heart. I'm proud now to be friends with Lori Robinson from California. Last year, Lori was invited by Dr. Kevin Sabet, Smart Approaches to Marijuana, to speak at the Heritage Foundation in Washington, D.C., along with a group of well-known scientists. Lori spoke for the first time about the untimely death of her eldest son, Shane, at age 25, from fatal consequences of naively using recreational pot. Lori holds a master's degree in nutritional science and has worked in healthcare for over 30 years. She currently works as a nephrology dietitian, as she's board certified in this specialty. Lori and her husband were richly graced with 2 healthy sons, born in 1986 and 91, and they enjoyed many incredible years celebrating vacations at their family cabin, where their sons developed a passion for all water sports, had a beautiful future in front of them. The Robinson family strongly believes if this tragedy could happen to them with a strong history of longevity and vitality, this can happen to any family.